Paul Apyan, orthopedic surgeon with University of Orthopedics and Erlanger Medical Center, talking about hip and knee replacement this afternoon on This and That. And it seems like, I mean, even this morning, first woke up, George W. Bush is about to undergo knee surgery. And right this very second, I know 3 people personally that are in the hospital because of they're getting their knee replaced.
The hip and knee replacement procedure is the most positive thing you can do in your life in terms of getting rid of pain. And in the United States, we do probably 400,000 hips and about 500,000 knee replacements every year. It gets rid of pain.
You know. All right. I'm thinking of the former presidents, and I'm thinking of the 3 people I know personally that are between the ages. I'm guessing late 50s and early 60s. Is that like the normal age, or does it vary?
The normal age is becoming younger. When we first started doing them, it was basically for people retired over 65. But as the technology's improved, arthritis is catching up with us. Our obesity issue actually wears these joints out faster. We're seeing the age come down some. I had my hip replaced 6 years ago. I'm 61. I had it done when I was 55. Fantastic. But yes, they're becoming younger and younger.
And we hear of so many doctors that are performing hip and knee replacement. How do you find the right doctor to perform your surgery?
There are a lot of right doctors. And what that patient needs to do, and I did when I was a patient, is you interact with your doctor and you go and talk to them and you say, and if they evaluate you and say, here's the non-operative things we can do first, we'll go through those, then we'll talk about surgery. And then, if you develop that relationship that you want to go back and be treated by him, then when you get to needing the surgery, whether it's a hip or a knee, then you ask the doctor, which implant do you use? Because, James, there's 20 different manufacturers out there, and they all market and advertise that theirs is better than the other. And actually, the data hasn't shown that with some of the new designs we've had the past 10 years. They're all basically the same. It's dependent on the surgeon putting it in.
Well, that is really interesting because I've never thought about that with the material that's going into your knee plays a part in the decision of who you pick, right?
It does, because most doctors don't put all 20 of them in. They usually have a 1 or 2 brand preference, and they're very good with those particular ones.
Okay.
And I happen to use 2 different brands, but I'm really solid with that. I like doing that, and I'm most comfortable. Occasionally, we'll have a patient come in and say, hey, I got this off the internet. Would you put this in? And I'd say, I'd like to, but I don't have any experience with it. I prefer to use what we've been using for the past 10 years that works year in and year out. We're getting excellent results, and we're getting rid of your pain.
Well, that's very interesting because I didn't expect that. I mean, because when you go into a doctor and say, okay, I've got some discomfort in my knee, and he suggests surgery. So should we be asking the doctor about these products that's going inside your body?
Some do and some don't, but when they have pain, we don't go to surgery first. Even though I am an orthopedic surgeon, trained in orthopedic surgery, the first thing we want to do is alleviate the pain without having to operate. When we fail, when those don't work, the cortisone shots stop, then we talk about replacements, and you might ask them, which brand do you use? And we can talk about that and tell them why. We're most comfortable with this particular one because of the nuances. And most patients are very happy with that. It's building that relationship with your patient.
Doctor-patient relationship, that's what it's all about.
It's number one.
Thank you very much. Erlanger.org for more information.
Yes,
Dr. Apyan, thank you very much for being
on
This and That. Until, let's see, tomorrow. We'll be back here with you tomorrow. Have a great day. So long.